For millions of people, the traditional antidepressants just don't cut it. They don't provide the relief they so desperately need. This is what's called treatment-resistant depression, and man, it can feel like you've hit a dead end. But what if there was a totally different way to tackle it? Today, we're going to dive into a therapy that's really changing the conversation: nasal ketamine. So how exactly does it offer a glimmer of hope when pretty much everything else has failed?
And that's really the core question, isn't it? You've tried different medications, you've patiently waited for weeks, sometimes months, for them to kick in, and you're still stuck. It's an incredibly frustrating and, honestly, a pretty hopeless place to be. This is exactly the problem that this new therapy was designed to solve.
Okay, so let's get specific about what we're talking about here. Treatment-resistant depression isn't just a phrase for feeling frustrated. Nope, it's a real clinical definition. It means a person has gone through at least 2 complete trials of different standard antidepressants and still hasn't seen any significant improvement. That is the official starting line for even considering these kinds of alternative treatments.
And that right there brings us to this new hope. We're not just talking about another pill in a bottle. This is a fundamentally different strategy for managing major depressive disorder. So let's take a look at who's actually a candidate for this kind of therapy.
Now, the criteria here are really specific, and for very good reason. First, you need that formal diagnosis of major depressive disorder. And crucially, you need a documented history showing that other treatments just haven't worked. Now, here's something that might surprise you. It's actually used together with a traditional oral antidepressant, kind of like a supercharger. And because this is a pretty powerful medication, a recent history of substance misuse is a key disqualifier to make sure everything is safe.
So, how does this actually work? What is it doing inside the brain? This is where things get really fascinating, because it operates on a completely different pathway than the antidepressants most of us have heard about.
The actual drug we're talking about is officially called esketamine. It's a specific piece, a molecule, that comes from ketamine, and it's been specially designed to be absorbed really well through a nasal spray. And I've got to emphasize, this is a highly regulated, FDA-approved medical treatment. That's exactly why it can only be given in a controlled clinical setting.
This table right here, it just lays out the differences so clearly. Your standard antidepressants, they're mainly targeting serotonin. But nasal ketamine, it's working on a whole different neurotransmitter system called glutamate. So instead of that slow, gradual buildup over weeks, people describe this as more of a biological reset that actually helps the brain form new connections. That's neuroplasticity. And of course, the procedure itself is night and day. One you take at home, the other requires a mandatory 2-hour monitoring session in a clinic.
And this might just be the most revolutionary part of all: the response time. Traditional meds can take 4, 6, even 8 weeks to really start working. With esketamine, patients can start to feel relief in as little as 2 to 24 hours. For someone who is deep in the struggle of depression, that kind of speed can be absolutely life-changing. So the science is really cool, but what does this all actually mean for a patient? What's the experience like? Let's walk through the entire treatment journey step by step.
This is probably the question on your mind, right? It might sound intimidating, but the whole process is super structured, and it's all designed around patient safety and comfort. Let's break it down.
It all starts with a really thorough consultation to make sure you're a good fit. Then the clinic gets to work on the insurance side of things, and you sort out your ride home. That part is absolutely non-negotiable. On the day of your treatment, you'll actually administer the spray yourself, but you're in the clinic under the watchful eye of a professional. Then comes the most important part, the observation phase. You just kick back and relax in a quiet, comfy room for 2 hours while the staff monitors you. After a final quick check-in, you're good to go home with that driver you arranged earlier.
You've heard me mention supervision and monitoring a few times now, and there is a very, very good reason for that. Patient safety is the #1 absolute top priority, and the rules around this treatment are incredibly strict.
This quote just says it all, doesn't it? This is not some casual treatment you can do on a whim. The effects of the medication are potent, which means it can only and must only be given in a controlled medical environment by trained pros who know exactly what to expect and how to manage the experience.
So this all fits into a really solid safety framework. It's built around a strict FDA program that requires all the things we've been talking about. They check your vital signs like blood pressure, there's that mandatory 2-hour monitoring period, and staff are always right there to help manage any side effects like dissociation, which is a temporary feeling of being a bit disconnected. And that is exactly why the rule about not driving until the next day is an absolute must.
120 minutes, 2 full hours.
That is the minimum amount of time you will stay at the clinic after every single session. It's completely non-negotiable, and it's designed to make sure the most intense effects have passed and that you're totally stable before you leave.
All right, let's jump into some of the most common questions that pop up when people first hear about this therapy, starting with, the big one.
Of course, anytime we talk about medical treatments, cost and access are huge. So is this groundbreaking therapy something an average person could actually afford?
And the good news is, yes, often it is, because it's an FDA-approved treatment for a very specific condition. A lot of major insurance plans do cover it. Now, the clinic will have to get something called prior authorization, which is basically just proving that you've already tried other antidepressants. But yes, coverage is definitely on the table.
Okay, let's talk about it. Side effects. It is super important to be upfront and transparent about what a patient might actually feel during that 2-hour observation period. So the most common ones are things like temporary dizziness, maybe a little bit of nausea, and a brief rise in blood pressure. Those are all expected and monitored. The most unique side effect, though, is that feeling of disassociation, kind of a dreamlike or disconnected state. But the most important thing to remember is that the clinical team is there, these effects are well understood, and they almost always go away completely before you leave the clinic.
So what's the actual time commitment here? Well, the treatment usually starts with what's called an induction phase. For the first month, that's 2 sessions a week. After that, depending on how you're doing, you move into a maintenance phase. The sessions become less frequent, maybe once a week, then every other week, and for some, eventually down to once a month.
Okay, so let's tie this all together. What are the big things to remember? First, this is a new, really fast-acting option for treatment-resistant depression. It works in a totally different way by targeting the brain's glutamate system. And safety is everything. It's always given in a certified medical facility, there's that mandatory 2-hour observation period, and you absolutely must have a driver for every single session.
When you look at its unique way of working and the incredible speed of its results, esketamine really represents a huge shift in how we think about one of the most stubborn forms of mental illness. It really makes you wonder, are we looking at the future of how we treat persistent depression